I'm Angus King, United States Senator from the state of Maine. Well, one of the issues with medical devices is that nobody really knows the price except for the individual hospital that's buying the device, because quite often implantable medical device companies have a clause in the purchase contract that prohibits the hospital from disclosing the price that they're paying. I just think that doesn't make a lot of sense, particularly in the context of a discussion here in Washington about repealing the medical device tax. My position is, if we're going to repeal the tax, let's open up the process a little bit so that the taxpayers who are footing the bill for a large percentage of these devices can tell exactly what it is they're paying, and also that the median prices be reported from time to time so that there is some transparency and accountability in this area. Well, the first level of transparency is to prohibit these gag orders on the hospitals so that they themselves will be able to clarify and make public what these costs are that they're paying. Secondly, there be reports to Health and Human Services, to CMS, so that the data would be available from across the country and people would be able to see what these costs are, and frankly have an opportunity to shop for hospitals to know what the comparisons are and what their neighboring hospitals are paying. I mean, I don't think there's a car dealer in America that wouldn't like to make us all sign a confidentiality agreement that we couldn't tell what we paid for our car, but that's not the way the market is supposed to work, and it isn't working in this case, so that's the basis of this proposal. Well, it's hard to handicap votes in the Senate on anything these days. It's a pretty difficult situation. Last year, when the budget went through, there were a whole series of kind of test votes. They weren't binding, but one of them was on the repeal of the medical device tax, and as I recall, it got something like 65 or 70 votes. So clearly there's a substantial amount of sentiment there to repeal that tax. Whether that's going to happen in the context of legislation that's before us right now, and whether our proposal will also have an opportunity to get to the floor, it's awfully hard to predict. I think I keep hearing about things that are going to be taken care of in the lame duck session after the election, but if everything I've heard is going to come up in the lame duck is going to happen, that means that lame duck session will be about 2 years. So everybody's planning to get things done then, but it's impossible to predict now. Things that you don't think are going to come to the floor, suddenly something opens up and it happens. But the legislative process has its mysterious ways down here, and you just have to be ready when the time comes with your ideas and your proposals. Well, there's a lot of data, but it's sort of coming from a lot of different sources. I think one of the best sources is the Kaiser Foundation, and they have a lot of information that's coming out. We are seeing a number of people getting coverage that didn't have it before, people that were excluded from coverage because of pre-existing conditions and that kind of thing. So I don't think there's much question. Kathleen Sebelius recently used the figure of 22 million. That was questioned by some sources, of 22 million people who had coverage under the Act. I think the number is probably somewhere between 16 and 22 million, but that's a lot of Americans. And I believe that you're going to see a significant increase during the next round of open season for enrollment starting this fall. Another little piece of data in Maine, our two major carriers that were on the exchange have announced their prospective rates for next year. One went up about 3%, the other one went up less than 1%, and we're going to have a third carrier on the Maine exchange. So I think the exchanges, at least from my little anecdotal perch in Maine, appear to be working in terms of providing some competitive pressure, because these, as you know, the increases on the individual market, which is what we're talking about here, over the past 10 or 15 years have averaged, well above 5%, and quite often in double digits. So I'm mildly optimistic about the course. I think more healthy people signed up than perhaps was expected, more younger people, and as you know, it's all about the risk pool. We had a nonprofit created in Maine, a co-op, and that's been very successful. They were very successful on the exchange. So, you know, given the rockiness of the start, I think we're seeing some real progress, and people are finding that they can find care at an affordable level that I think a lot of people have been surprised by that.